Hi, I'm Evelyn. I'm going to be demonstrating today how to do x-rays for the sinuses, mandible, and orbits. So I'm going to start with my sinuses, and I'm getting a few things ready before I get my patient. So I've already detented my tube at 40 inches. I got my cassette ready. I'm going to use the smallest possible, which is 8 by 10. I have a chair ready since for most all of these projections the patient will be sitting. I have my shield ready, and then also I have to wipe down the board before they get here because their face is going to be up against the bucky. So I'm going to do that now. Okay, now I'm ready to get my patient. Okay, I'm going to start with my PA axial, so I'm going to go get my patient now. Hi, Cameron.
Hi.
Come on in. My name is Evelyn. I'll be doing your x-rays today. Before we get started, can I get you to confirm your last name and your date of birth?
Yeah, it's Gerber, and it's 7/14/1989.
Okay, and what brings you in today?
I've been having some pressure in my head. I think it's due to allergies.
Okay.
And also, my jaw's really been bothering me.
Okay.
Mm-hmm.
And is there any chance of pregnancy?
No.
And do you have any facial jewelry or anything?
No.
Okay, perfect. So we're going to get started with your sinuses. What I'd like to do first is to get a shield on you. And this goes on backwards. So
Okay.
do this arm first, then do this arm. And then I'm also going to shield your thyroid. So, right there. Okay, go ahead and have a seat in this chair. Okay, and like I said before, this is a PA axial, and it's axial because the central ray, it forms a 15-degree angle from the CR, and I want to make sure that the mid-sagittal plane is lined up. And so I'm going to have you bring your face closer to the board, and to get that 15-degree angle, I'm going to have him push his chin up. So go ahead and push your chin up. There you go. And I have an 8 by 10 film in there. I can collimate a little bit tighter though. I don't necessarily need the top or the bottom of the skull, so I'm going to do that right now. Okay, and I want to make sure that the central ray is going to be exiting the nasion. And what I'm going to do my technique at is going to be somewhere between 75 at 10. And let me put my marker on there. Okay, so go ahead and hold your breath. Okay, and expose. Okay, go ahead and breathe and relax. And now we're ready to do our next. Now I'm going to do the Waters view, which is the parietal acanthial PA axial. Again, I've got my 8 by 10 in the bucky for this one. My tube is still detented to 40 SAD. And I've got my patient sitting, but what I need them to do is to place their chin against the wall bucky. I need the MML to be perpendicular to the IR, and then the OML is going to form a 37-degree angle to the IR. And now what I want to do is make sure that the mid-sagittal plane is lined up correctly, which it is, and then also the central ray, it's going to exit the acanthion, and at this point I can kind of collimate in a little bit tighter, which I'm going to do now. And then I'm also going to put my marker on the patient's right side. Okay, so my technique for this is going to be about 75 at 8 to 10 mass. So now I'm going to take my exposure. So go ahead and hold your breath. Okay, and expose. Okay, breathe and relax. And now I'm ready to move on to my next. Now we're going to do the lateral sinus, and his left side is bothering him, so we're going to get him into an LAO position. So what I'm going to have you do is put your left cheek against the wall bucky. There you go. That's perfect. And I need to make sure that the intercapillary line is perpendicular to the IR. So I'm going to go ahead and bring his head down a little bit. And then also now the mid-sagittal plane is no longer perpendicular, it's parallel with the IR. The IOML is perpendicular to the front edge of the cassette. And the central ray is going to enter a 1/2 to 1 inch posterior to the outer canthus, which it's already at. And I can also collimate a little bit. Tighten I'm gonna put my left marker on. And my technique for this is gonna be 75 at 8. And I wanna give breathing instructions, so go ahead and hold your breath. And now I'm gonna take my exposure, expose. So go ahead and breathe and relax. And now we're ready to move on to the SMB. Okay, so now we're gonna do the submental vertical for the sinuses. And for this position, I now have my patient sitting in the opposite way in the chair. So I needed to flip around all of the shields that I have on. So this shield and the thyroid shield, they're on facing front. And so now what I need you to do is I need you to tilt your head far back. There you go. And I want to make sure that the mid-sagittal plane is perpendicular to the IR, which it is. And I want to have him extend his head so that the IOML is parallel to the IR. So I'm going to have you extend your head further back, just like that. And the central ray is horizontal to the IOML and IR, and it enters about 3/4 of an inch anterior to the EAM, which is right here. And it's also entering at a point between the gonions, which you can see right there. And I'm going to collimate, so just like that. Are you doing okay?
Yeah.
Okay, so I'm going to put my left marker on, just to mark the anatomical side. And for this, my technique is going to be about 70 at 8. So go ahead and hold your breath. Expose. Okay, go ahead and breathe and relax. And so now we're done with our sinus series. Okay, so now I'm going to start my mandible series. So now I have my patient facing the bucky because we're going to do the PA axial. So now the shield is on backwards to protect him from the beam which is hitting his back. So what I want to do now is have my patient place their forehead and nose against the bucky. So go ahead and do that. I want to make sure that the mid-sagittal plane is perpendicular to the IR, and also that the OML is perpendicular to the IR. So that looks good, and the OML is perpendicular. I want to make sure that my tube is angled 20 to 25 degrees cephalad. And I want to also make sure that the central ray is exiting the acanthion, which it is right now. So at this point, what I need to do is I just need to cone in and collimate because we're only looking at the mandible. So take that, go in about right there. And then also I need to mark the anatomical side. So I'm going to go ahead and do that right here. And my technique for this is going to be somewhere about 75 at 10 or 12. So go ahead and hold your breath. And now I'm taking the exposure. Expose. Okay, so go ahead and breathe and relax. And I'm going to run my 8x10 that I used for this. And now we're going to move on to the obliques. Okay, so now we're going to do our axiolateral obliques. So now the central ray is 25 degrees cephalad, and I'm having the patient turn towards the affected side, which is the left side. So I'm going to go ahead and have you place your chin against your left side of your chin, or your cheek against the IR. So I want to make sure that for the ramus, that the head is in a true lateral, the interpupillary line is parallel to the IR, and I also want him to extend his chin so that the long axis of the mandibular body is parallel to the transverse axis of the IR. And we also want to make sure that it enters the mandibular region, which it is right now. I'm going to go ahead and collimate. So I'm going to have you actually move this way a little bit, right there. I'm going to collimate inside to side, and then top to bottom. I'm going to have you relax your shoulder. And since it's his left side, I'm going to put the left marker right there. My technique for this is going to be about 75 at 8. So right now I would go ahead and take my exposure. So go ahead and hold your breath. Expose. Okay, breathe and relax. So at this point I would run my film, and then I would come back, reload my film, which is an 8x10, and I would get ready for the mandibular body, which is the same positioning as the last one, except the only difference is that now I would have them turn their head 30 degrees towards the IR, so I'm going to go ahead and do that now. So go ahead and turn 30 degrees towards the IR, right there. That's perfect. And it's still entering the mandibular wide region, and I can probably even collimate a little bit more, right there. And my technique is going to stay the same as the last one, 7, 5, and 8. So go ahead and hold your breath, expose, breathe and relax. And so now I'm going to run my film for this one, and then I would come back, reload my 8x10, and then position for the symphysis, which is the same positioning as the last ones, except now he's turning his head a full 45 degrees towards the IR. So we're going to go ahead and do that now. So go ahead and rotate your head right there. That's good. And I'm going to have you go back a little bit right there. Okay. And I can collimate in side to side a little bit more right there. And my technique for this is the same, 75 at 8. So go ahead and hold your breath. And now I'm going to take my exposure. Expose. Okay, breathe and relax. And now I would run my film for this, and we're done with the mandibular series. Okay, so now I'm going to do my orbit series. So I'm going to start with the modified waters. So I have my patient standing, and then they're shielded from behind, so because the beam is coming at them from behind. So for the modified waters view, I'm going to have the patient place their chin on the IR, and we've taped the film to the Bucky because this is a non-grid projection that we do. And so what I want to do now is make sure that the mid-sagittal plane is perpendicular, which it is, and also the OML forms a 50-degree angle to the IR, which it is right now. And I want to make sure that the central ray is perpendicular through the mid-orbits. And since we're only looking at the orbits, I can collimate a lot for this. So I'm going to go ahead and do that. I only need about that much. I can probably even take it a little bit side to side. And I'm going to go ahead and mark the anatomical side. Right there. So for this, my technique is going to be somewhere around 70 at 20 kVp because there's not a grid. And at this point, I would just make sure that my patient is staying still, and also close your eyes for this exposure and try to hold as still as possible. So now I'm going to take my exposure, expose. Okay, now you can relax. And now I'm going to do my Reese method. Okay, so now I'm going to do my oblique for the orbit. And the left side is bothering him, so I have him in an LAO. And for this, I need the zygoma, the nose and the chin to touch the IR, which he's already positioned for that. And the central ray, it's going to enter 1 inch superior and posterior to the top of the ear attachment, which it is right here. And then for this, I can collimate because we're only looking at the orbits. So I'm going to collimate a lot, right about there, and then side to side a little bit. And then since the left side is the side that we're looking at, I'm going to mark it right up here. And this is a non-grid technique, so it's still going to be about 70 kVp at about 20 mass. And again, he's still shielded for this since it's in his backside. The shield is on backwards. So I'm going to go ahead and take my exposure now. So just hold still, expose. Okay, go ahead and relax. And we're all done here today. So I'll go ahead and take this off of you. And now I'll show you back to the waiting room. Okay, so now I'm going over images. The first one is the PA axial Caldwell for the sinuses. So this is what the radiograph should look like. And you do this to see the frontal sinus and the anterior ethmoid sinuses. And some things that you should look for is that the petrous ridges are in the lower third of the orbits, which you can see right here. And also there's no rotation. You want equal distance between the lateral border of the skull and the lateral border of the orbits. Okay, so this is the parietal acanthoidal waters
projection for the sinuses, and what you should see on this radiograph are the maxillary sinuses, the frontal sinuses, and also the ethmoid sinuses. And what you're looking for on this radiograph is that the petrous ridges are immediately below the maxillary sinuses. And then also you want to check for rotation. So you're looking to check that there's equal distance between the lateral border of the skull and the lateral border of the orbits on both sides. Okay, so this is the lateral projection for the sinuses. And the patient's usually in either an RAO or an LAO. And what you're looking for here are all four of the sinuses. So you see the frontals, you see the maxillary, you see the ethmoid, and then you see also the sphenoid sinus. And something that you want to check for is that there's no rotation of the sella turcica. You want superimposed orbital roofs, you want superimposed mandibular rami, and those are supposed to be superimposed just so there's no rotation. Okay, so this is the last projection for the sinuses. This is the submental vertical projection, and what you're checking for on this one, you're looking specifically at the sphenoid sinus and also the ethmoid sinuses. And something important on this one is you want to make sure that the mid-sagittal plane is perpendicular. So you're going to check for equal distance from the lateral border of the skull to the mandibular condyles. Okay, so now on to the projections for the mandible. This first one is the PA axial projection for the mandible. Some things that you want to look for are that the whole mandible is shown, also that the mandibular body and rami are symmetrical on each side. That would show no rotation. Okay, so now I'm going to go over the axiolateral projection for the mandibular ramus. And this is when the patient is in a true lateral. And something that you want to make sure is that you can see all of the ramus. This is the area that you're looking at. And you want to make sure that there's no overlap of the ramus by the opposite side of the mandible, no elongation or foreshortening of the ramus or body. And then next is the axiolateral oblique projection for the mandibular body, which is all of this right here. And some things that you want to make sure on this one, just like the other one, there's no overlap of the ramus by opposite side of the mandible, no elongation or foreshortening of ramus or body. And then the last oblique is the axiolateral oblique mandibular symphysis. So this is the area that you're looking at right here. And for this one, you want to make sure that there's no overlap of the mentum region by the opposite side of the mandible, and also no foreshortening of the mentum region. Okay, so now I'm going to go over the orbit series. So the first one that we did was the modified waters for the orbits. And so something that you want to look for on here is good collimation or the use of a cone. You don't need the top or the bottom of the skull. Something else, one other thing that you're looking for is where the petrous ridges are projected. They should be immediately below the inferior border of the orbits, which you can see on this one right there. And then you want to check for no rotation. So you're looking for equal distance from the lateral orbit to the lateral skull on both sides. Okay, so this is the last projection. This is the parietal orbital projection, also known as the Reese method for the optic canal and foramen. So something that you want to see is good collimation. You only need the whole entire orbital rim, which is all of this right here. You can see here they used a cone. You need the optic canal and the foramen visible at the end of the sphenoid ridge in the inferior and lateral quadrant of the orbit, which is shown on this projection. And you also need to watch for the supraorbital margins lying in the same horizontal plane. And that's it.